and accessible course practices as well, which the SFSS has been advocating on. So would lecture recording make course content more accessible for spring 2022? 94% of respondents said yes. And this could be due to, a bunch of reasons in regards to, I guess, from what we've been told, expect to get COVID. So if you are sick and you cannot return to classes, this would make it a lot easier. And especially like the long-term implications. Some students and also folks report that they are still having ongoing symptoms and whatnot. So making these lecture recordings is a more accessible practice, and I think should also be implemented into the future as well, just in regards to students' ability to learn, and also if they cannot attend classes in these precarious times. So I want to outline some of the students shared their concerns returning to campus. And a couple of these are identified to safety and wellness. As we can see, some students are saying it was anxiety provoking to go to school, to be around large groups of people with little safety protocols besides wearing a mask. I'm also very scared to go back in person in the spring 2022 semester since the cases have been rising. The main focus should be keeping students safe, therefore provide a safe online learning environment first and give support to students that still want to come into class. So just looking at that, there has been an array of concerns that have been raised from this survey that we have seen regarding this issue. Around wellness, there was a lot of mental and emotional strain associated with in-person learning because I was afraid of contracting the virus and being sick myself and taking it home to my elderly grandparents. I prefer online because with COVID, my mental health around the fear is very real and hard to manage, and I'm very scared of coming back to classes. So this is just a few voices that we've heard from students. And I think that we should not negate from the fact that, we want to prioritize mental health, but there is a large majority of students who feel the need that this is anxiety inducing for them, as well as we have, folks with a different array of needs, students with disabilities and accessibility needs who may not be able to just get COVID and be okay with that. And folks who have family members who are immunocompromised or even immunocompromised themselves, we need to make sure that we're taking community care when it comes to this. And I think that these statements reflect just that. So the survey outlined clear calls to action from students, and these were some of the things that were outlined. Clear universal procedures and concession policies for all classes for students who are ill or in COVID-19 isolation. So this looks like, ensuring that students have access to either extensions or withdrawals or recorded lectures, and ensuring that they are provided the most support in their learning environment. The next is remote or hybrid options to support students who are ill or isolating. This was a huge one that we just seen from other respondents of our survey. A lot of students wanted these options. Recorded lectures in every course made available online for students who must be absent due to illness or isolation. And I think this is a must, especially moving forward, because we've seen with the precarity of COVID, things can change in a matter of days. And this hasn't changed, as we've seen throughout the duration of January and fall and the last few years. Technical support and infrastructure to ensure faculty, staff, and students can ensure online learning tools proficiently to assist with troubleshooting. So this is a big thing that we've seen. When we look at the fall 2021 semester and the return to in-person learning, there was a group of, first-year students. This was their first semester at SFU. They did not receive technical support in regards going back to online learning. And also in the spring semester, a group of, first year students coming in to SFU who may not have had the opportunity to properly have proper tech to support online learning environment. So just ensuring that these resources are available for students. And then so easy access to PPE and health measures, which includes masks, hand sanitizer, and on-site testing. What we have been told is that with the variant, we need to be wearing N95, KN95 masks, and cloth masks, and also some of the other masks that we've seen are not adequate enough, especially in 100-room classrooms or like lecture halls and things like that. And we need to make sure that if we are returning to campus, these things need to be put in place to ensure our protection, because the onus again is once put on students, and it is actually an accessibility barrier, because not everyone, like, we cannot afford N95 or KN95 masks for what they're going right now. You can't expect students to pay for that. So the onus should be put on the university. Another is regular opportunities for students to provide feedback. Again, this has been something, lack of consultation from the university in order to actually hear what students want. And so that's why we provided this feedback, was to hear directly from our membership on what they wanted and what they needed, in order to advocate and address the concerns that we have been seeing, because for a while we haven't seen a lot of the student voice in these decision-making processes, which is really problematic, because we are the ones going to class. We are the ones put in these situations.
As mentioned earlier, we released a public statement on December 23rd, 2021, and in that way, we responded and made calls to action to SFU and the BC government. So these are the ones we listed to SFU. Number 1, move classes and exams to be remote for the entire spring 2022 semester. And this decision is to be made well in advance of the January 4th, 2022 start date. Last minute changes done on a week-by-week or month-by-month basis is not a sustainable learning and teaching environment. Number 2, public declaration of outbreaks and also contact tracing administered if positive cases arise. This includes the date, time of lecture, class, classroom number, professor, and class capacity. Number 3, make rapid testing inaccessible to all symptomatic and asymptomatic students, faculty, and staff on all campuses in the upcoming semester and for the duration of the pandemic. Number 4, students should receive support when they test positive for COVID-19, including but not limited to managing COVID-19 symptoms, managing emotional issues related to isolation or quarantine, and the prevention of alternative food service arrangement for those who live on campus. As a continuation, number 5, host a mass vaccination clinic or set up smaller vaccine venues on campus to promote vaccination or facilitate access to off-site vaccination services within the community. Number 6, ensuring that course syllabi are consistent throughout the semester and no last-minute changes will be made in regards to exams, coursework, and assignments. So for example, we've seen in fall 2021 semester, moving exams from in-person to online without adequate at least one calendar week notice or ensuring significant and appropriate accommodations are made. So last minute changes were made in the fall 2021 semester, and that was detrimental for some students. The next is ensuring faculty who are vaccine hesitant to deliver courses remotely, even upon any possible return to majority in-person instruction, to ensure their safety and students' safety. Moreover, flexible learning accommodations for students in regards to exams, assignments, and courses for those who have COVID-19 anxiety, or who have family members affected by COVID-19. As for SFU, as a continuation, we also wanted broader communication around academic concessions, easier access to deferrals, extensions, and alternatives to the attendance requirements and mandatory in-person participation. Continuation, accommodations for international students, so for example, remote learning, online submission for assignments instead of submitting an assignment by paper. Ensure the continuation of the pass credit, no credit grading system for the duration of the pandemic, which was implemented in 2020, and we want to see this continue. And a comprehensive communication plan should be in place about COVID-19 safety decisions tailored to SFU needs using actionable strategies. So this plan should include any relevant guidelines on what to do after returning from travel, as we are in a season where a lot of people travel to see family and loved ones, especially since folks are coming from their holiday break. Matt?
Yeah, thank you. So some calls to action that we presented for the provincial government was to ensure that rapid testing is accessible to all symptomatic and asymptomatic students, faculty, and staff on all campuses across BC, just so that there's that sense of security and reasonable access to these resources. Another thing that we want to do is urge post-secondary institutions to make vaccines mandatory for all students, faculty, and staff on campus who are not medically exempt. Another is urge post-secondary institutions to shift on-campus learning and work to be remote for the spring 2022 semester with seeing the rise of variant cases. Create accessible financial opportunities, grants, and sources of funding for students being impacted by COVID who have had to take time off of work or school for illness. So this was something that we needed to see, especially because a lot of students have been put in precarious financial situations throughout the duration of the pandemic. And there is more financial need, especially for marginalized BIPOC and disabled students who need those supports moving forward. So this should be a continuation until we are able to ensure that folks are receiving the care that they need.
Gabe, I'm going to let you hop in.
Sure. Thank you, Jess. So on Wednesday evening of this week, the Simon Fraser Student Society Council, which is our main governing body with our legal board of directors, voted in favor of closing the Student Uni Building starting January 24th until February 18th. Now, this was not an easy decision made by our council. It was a 3.5-hour debate. And that gives you just an idea of how many factors and what information went into the decision making behind this vote. By the end of the night, however, the vote did pass 38-3. That's 38 yes votes and 3 no votes. And all of these councillors represent a subsection of our university campus. Each represents their own program, their own major, their own student group. And so this really shows the support that was behind us from the student body and kind of going above and beyond what public health guidelines dictate and kind of showing that the student body understands that at a time like this, we need to be taking the leadership in order to provide or guarantee safety for our staff and for our membership. I think that in large part, the province and by extension, the university is treating COVID like it's an endemic already, but we're not there yet. COVID is very much still transmissible and with us. And we're not at a place yet where we can just say, you got to live with it and you got to deal with that. We are fully prepared to continue to look at where the pandemic is taking us, look at the data, and decide whether or not there are measures that we can pivot to as the situation gets worse or the situation gets better. Our council will determine by February 18th whether or not this closure needs to be extended or not, or whether or not we can open again, but at reduced capacity. Whatever council decides, it will be with informed information from our membership and with a clear understanding that the decisions we make can literally be life or death that affect staff members, that affect our membership.
I also want to take this moment to acknowledge that we do have a new live stream link that is now working. So moving forward, we will continue to the end of this press conference to take in questions from the media. Once the questions from the media are completed, myself, Matthew, and Gabriel will restart our press conference, go over the introductions, and go over the survey results. And then Gabe, if you're okay with discussing the subclosure one more time, just for the purpose of the live stream. Okay, so now we will move on to the question and answer period. This is just for the media as it is just a press conference. So I'm going to stop and share my screen. And I ask that you folks just raise your hand using the function if you are able, and then I will call on you. Simran?
Hi, yeah, Simran Singh with Burnaby Beacon. I just had a quick question. So when I did reach out to SFU admin last week, they said they would have a rapid testing plan that would be announced shortly to students and school staff, as well as the community. I wanted to know if that plan has been announced and if SF at the SFSS is aware of any rapid testing rollout and plan on campus. And yeah, have you heard anything from admin regarding that?
Yeah, thank you for the question. We are aware that there are plans in development for a rapid testing program. We don't yet know what that's going to look like. Rapid testing and just general PCR testing has been something we've been calling on SFU and public health for essentially since September, since the fall return to campus, as something that was absolutely essential and that we needed to ensure that our community was safe. When we look at PCR testing alone, the closest testing centers to SFU are quite inaccessible. If you live on Burnaby Mountain, say you're a member of SFU residence and housing, or you live in University, the closest testing centers are one by Coquitlam Central Station and two by BCIT, both of which are 20 to 25 minutes by car, let alone for the students who use transit, which would likely be around 40 to 45 minutes to get there. It's very inaccessible, and for for the recommendation that if you are sick or feeling ill, that you are supposed to stay home until your symptoms subside or you get a negative COVID test. It's unfortunate that it's so inaccessible at this point. In terms of rapid testing, there hasn't been any widespread access to rapid testing on campus, except for a pilot, not a pilot, rather, a program available to students and community members who self-declared themselves as unvaccinated as a supplement to the fact that they are not vaccinated. That's all that we know about the rapid testing program to date, but I hope that information about rapid testing on campus will be made available soon, as we are returning on Monday. It's coming up very soon. Matt, did you want to add anything to that question, that answer?
Yeah, sure. So there was actually some stuff that we've been able to do like internally with as the student society. On December 29th, I was able to register the SFSS to receive rapid tests for staff through the Government Canada website that I found. We're still awaiting a confirmation on that. But other than that, in regards to rapid testing, that is all the information that I have, but I do know that they've been really difficult to access as of right now.
Yeah, and I'll add this as well. It's not directly related to testing, but in terms of access to PPE for community members, the SFSS has actually ordered, and we're waiting for that to ship now, is a large order of N95 masks that we are going to be providing to our membership for free, as we've been as we begin to understand the science behind the fact that N95 masks provide a significant higher level of protection than a cloth mask or a non-medical grade mask does, so that we can provide students with the protection that they need when they come back to campus on Monday.
Please feel free, anyone, to ask any questions with the raised hand feature, and Jess will call on you.
Jesse.
Hi, Jesse Wensloff, CGSF 90.1 FM. I'm just wondering, have you presented the results of the survey you conducted to the university? And if so, what has their response been?
I will answer this first, and then Matt, if you'd like to hop on. We have not yet, we did release it in the earlier portion of this press conference, only a portion of it though, however, and I do understand that the live stream was not working, so we will go back and restart the press conference after media has finished and asking questions. Our staff still needs to look through the answers just one more time, because there were options for students to submit text answers, where some of them we do need to make sure that their privacy is protected. So we will hopefully release that soon. As of now, we do have a document compiled. Matt?
Yeah, so we were kind of planning to have more information released today, and there will be hopefully something shortly sent out, because we're waiting for a more concise proportion of that survey ready to be sent out. So hopefully you will see that soon.
And then a media package is to be also sent out to the media here in the Zoom. So hopefully keep an eye on that as well. We will be taking questions until 2:25 p.m. and then we will restart the press conference again. If after 2:25 media you have no more questions, or even before that, please feel free to head out, and you can also email us any questions that you have. Before you go though, Matt does want to touch on the subclosure one more time.
Yeah, so since our live stream is working, I think there was a lot of concern in regards to SFU students finding out the news of the student union building closure. As the executive committee, even prior to the council vote, we have made various decisions during and throughout the month of January, and even over the holiday season, which have been very difficult, but remained urgent regarding the ongoing conversation of COVID and the rise of cases. I want to preface that these ongoing discussions and considerations have been made with the intention of community care, limiting exposure and transmission among our membership and staff and the SFU community. We've had to act urgently since we know that we have seen ongoing changes in precarious situations. I also want to point out and reiterate that within the student union building, we find ourselves in a very unique situation. So in regards to that, the executive committee made a recommendation to council for the sub building to be closed until February 18th. So with this recommendation, it took a few weeks because we did have other things in place, such as reduced capacity which we did touch on earlier in the presentation, but the reduced capacity model left only single occupancy seating within the student union building, which took 1,000 seats that is typically in the sub for students to study and eat and all these things at which it is intended for, down to 100 seats. These are all single occupancy to reduce the transmission and exposure of COVID. Even with this, we cannot guarantee that students upon their return to campus will not be exposed, or guarantee their safety in the student union building with the risk of the variant. So with that, we wanted to take into consideration of our staff. There have been some procedures and things that we have put in place ultimately to protect our staff. And for the student union building, we have a 6-person minimum staffing requirement for the building. And with what we've seen with the rise of the variant and COVID, we've basically just been told, expect that you will get COVID. If you have these symptoms, assume that you have COVID. And with students returning to classes and coming into the sub, we can also not guarantee their safety as well. So as this may be concerning for students, we just wanted folks to understand that, we have also given the option to our staff to work remotely. So moving into that, I think folks just need to understand that when we look at this from a place of community care, if, hopefully this is something that, even for my personal opinion, I did not want to gamble, that we're like, okay, we'll open the building and just see, because a lot of our building staff are front facing and work in various sectors of the building at various times and are in contact with students and also other staff. So it doesn't take a lot for someone to be asymptomatic, which we know is something that occurs, and then also bring it to an evening shift or another department. And then sooner or later, we have, various people who may contract COVID in the building. And with that, regardless if we made the decision or not, in that circumstance, if we did not meet that minimum 6 requirement, we would have to close the building abruptly. And that is something we did not want to do, because that doesn't give us proper time for communication. That does also, the building would have to be closed until further notice, because while we're taking that into consideration, some folks will be recovering from COVID, and we also don't know the long-term effects of that. So they may not be able to return to work as soon as we want them to, or as soon as they are able to. And then also with that, we have to take into considerations that folks may be isolating, and then we might just be waiting for other folks checking their symptoms and things like that. So there's a lot of measures and things that go into that we need to consider, because as we have given the ability for our staff to work remotely, we cannot force them to come in if they feel the environment is unsafe. So we cannot be filling spots to meet this requirement as well. So as the executive and as it was voted on at council, we thought it was a good decision to be proactive in that, just so maybe in February, we don't know if we're able to meet this requirement, hopefully, not due to COVID or something like that. And that's something we weren't willing to risk at this point. So I hope that clears up some questions.
Thank you, and we will keep taking questions from the media until 2:25 and then restart the conference for the live stream. If there are no further questions, we are going to restart. Thank you everyone who came here today in the Zoom. Apologies again to folks on the live stream as we were having tech issues. So Gabe and Matt, let's do this one more time.
Hello, everybody. My name is Gabe Leosis. I am the president of the Simon Fraser Student Society. Accompanying me today is SFSS VP External Matthew Provost and VP Events and Student Affairs Jess Dela Cruz. Welcome to the SFSS COVID-19 press conference. Today is January 21st, 2022. Before we get started with the press conference, I would just like to acknowledge that today, at least where I am right now, I'm calling from the traditional unceded territories of the Katzie and Kwantlen First Nations. The territories of the physical SFSS are located on the traditional and unceded territories of the Coast Salish peoples. This includes the Musqueam, Squamish, Tsleil-Waututh, Coquitlam, and Katzie nations. I want to recognize that this is a virtual press conference, and that means we're all calling in from different locations. And so we should all be taking time and agency to understand who the stewards of the land are that we are currently situated on right now, understanding what our roles as settlers are and what that means in terms of standing in solidarity with Indigenous communities. It's my honor to introduce the SFSS VP Events and Student Affairs, Jess Dela Cruz, who is our host for today's press conference.
Hey everyone, I'm Jess, she, her, hers, and I'm VP Events and Student Affairs with the Simon Fraser Student Society. Earlier today, at least an hour ago, we had media in our Zoom link present so that we can ask questions at the end for a Q&A period. And we did intend to do the live stream for the public on YouTube. However, due to tech issues, we are restarting the press conference again after we had finished taking questions from the media. So this is round 2. Before we get started, I want to give an overview of our press conference today. So we'll do another round of introductions from some of the members of the executive committee. We will discuss SFSS response to date of COVID-19, our response to British Columbia's provincial health orders, and our response to SFUs. We'll also look at the survey results, which we surveyed our membership on their experience with their in-person learning for the fall 2021 semester, and their comments and concerns about their experience with in-person learning and their concerns and their worries for return to campus on Monday, January 24th. I would also like to note that the surveys that we are showing today is only a portion, and then we will release it soon to the membership and to the public after we have gone through the survey questions to protect our students who submitted the text box answers. To our audience here, thank you. Thank you to the folks in the live stream who have been patient and still sticking around, and thank you to the media who have joined us earlier. So again, the SFSS Executive Committee is made up of 7 executive counselors, and for today's press conference, Gabe, Matt, and I will be your hosts and panelists. And Matt, are you able to do your introduction?
Yeah, hello, my name is Matt Provost. My pronouns are he, him, his. Currently situated as an uninvited guest on the traditional Coast Salish territories of the Musqueam, Squamish, Tsleil-Waututh, Coquitlam, Katzie. Originally from Blackfoot territory, which is Treaty 7. So yeah, glad to be here today.
Thank you, Jess, and thank you, Matt. Hi, everyone. My name is Gabe Leosis. My pronouns are he, him, his. I'm the president of the Simon Fraser Student Society, and glad to be here. I think I already did that introduction off the top, but there's my name again.
Okay, let's get going. So the current SFSS stance, what is it? The Simon Fraser Student Society released a statement on December 23rd, 2021 to call on SFU and the BC government for stricter health measures and supports for SFU students returning to campus the following semester. So that would be the semester that we are currently in, spring 2022. Essentially, we described our concerns for return to campus and the lack of care SFU and the BC government has on post-secondary institutions within the time of the high transmission of the Omicron variant. And at that time in December, the recent changes to the PHO changed more of our guidelines, which had no support for post-secondary students. We wrote on our statement, quote, "Young people are particularly vulnerable to be exposed to COVID-19 and catching the virus due to in-person classes, work, volunteering, and community outreach. We are a population that must not be forgotten and needs better protection and support," unquote. On the same day, it was the initial date of many of our advocacy campaigns and our continued pressure to the government and SFU. As VP Events and Student Affairs, my main concern at that time was the heavily increasing cases of COVID-19 due to Omicron and the high transmission of this virus in gatherings, especially within events as we've seen from the PHO. On this last day before our services closed before the holidays, I met with our member services clubs and student union staff to implement the following changes. All indoor on-campus SFSS and SFU Spaces events until January 18th have been cancelled. Off-campus events previously approved must be revised to reflect recent PHO guidelines, and no new events will be reviewed for acceptance due to holiday closure. We also stressed that in the event there were changes to the PHO during the holiday break, and if that does happen, then it is expected by our membership that they adhere to these new rules to their indoor or outdoor gathering. I also want to note that next week on Wednesday, I will be meeting with our staff again to review our event guidelines and policies with the recent PHO guidelines as well as a recent sub-closure. So more announcements will be made on that as well. Our staff and executive team were extremely proactive in this situation before we had to close our offices for the holidays. And we had the expectation that there will be an increase in COVID-19 cases during the break as well.
So in the face of the COVID case surge over the holidays, the SFSS had a number of decisions to make in terms of how can we help mitigate community risk. So one of the first things was looking at the student uni building. So the SFSS and executive committee, the SFSS executive committee and management staff met almost daily for about an hour or an hour and a half at a time every day since beginning of January to discuss what our response to this COVID wave would look like as it pertains to not only our internal operations, but also our events and advocacy. As it pertains to the student union building, we had officially opened the sub for the first time ever on August 23rd, 2021, in anticipation of a full on-campus return for the fall semester. And one point I'd like to emphasize is that as an organization, the SFSS has only ever seen the sub either completely shut down, which was during the height of the first, second, and third waves of COVID, or fully operational, which was the case during the fall 2021 semester when we opened for the first time ever. So never have we actually operated at a reduced capacity model or a type of hybrid closure. But with Omicron, Omicron has completely changed the game. We recognize that by the sub's very nature, it's a mainly social space. It's where unorganized gatherings occur. And this is actually a good thing because this is what the sub was designed for specifically. It was designed for this purpose. Unfortunately, during the pandemic, we know that based on health guidance and the data out there, that social environments are the most risky settings. And therefore, the sub presents a significant risk for transmission of COVID-19 to occur. Which is why the executive committee took action initially to implement measures such as reducing the amount of seating in the building to encourage physical distancing. So the sub on its own has about a capacity of 1,000 at any given time. Based on these measures put in place to encourage physical distancing and reduced capacity, the building can now house about 150 students at a time. Further measures we took as it pertains to the student union building included encouraging our society staff to work from home. And we also informed SFU that despite a full return to campus on January 24th, we, the SFSS as an independent organization, would be prepared to escalate to a full shutdown of the student union building and being proactive in protecting not only the safety of our staff, whose safety we have to take into extreme consideration as an employer, but also our membership's safety. And this was made in anticipation that we couldn't guarantee transmission wouldn't occur even at a reduced capacity model. We needed to adequately protect these folks.
In terms of campaigns and joint letters, back in 2020, I launched a small online campaign titled #MaskUpSFU, where we encouraged SFU staff, faculty, student groups, and community members to wear their masks. We posted collages online of our community wearing their face mask at a time where we were first starting to be comfortable wearing them and having masks be part of our day-to-day lives. I again have recently relaunched this campaign this year with a few changes, asking that folks who do choose to participate in this campaign wear medical grade masks in their photos. This is to encourage folks to wear medical grade masks if possible, as they ensure higher protection and less transmission of COVID-19. And while we're at it, we are pushing SFU to provide SFU staff, faculty, and especially students for free KN95 or N95 masks. Right now we do have medical grade masks, just the blue ones that they do give us. Unfortunately, we still do not have access to these free KN95 or N95 masks at our institutions. Other campaigns that are being launched right now is by VP Equity and Sustainability Marie Haddad, who is working with our Graduate Student Society and TSSU and DNA to create joint letters to push SFU and the BC government as well for safer COVID measures for our institution. Matt?
Yeah, I just wanted to touch on the SFSS launched the COVID student survey a few weeks ago, and we've been going through and making sure that we're getting an adequate compilation of all of the data. And I believe that report should be finalized and will be sent out so that students and people who have filled it out are able to go through that, and we'll be sharing some of the results shortly.
And Gabe.
Thanks, Jess. And so in terms of lobbying efforts, since just before Christmas, the Student Society has been actively and loudly calling on the university and provincial government to endorse the delay of the return to in-person classes, at least until the Omicron wave begins to decline. Originally, we were calling for a remote semester for the entire spring 2022 semester. Our call to action has changed since then, and we're calling for remote teaching until at least the Omicron wave starts to decline, which we know based on some of the science we're starting to see out there, that could even be in 3, 4, 5 weeks time. When SFU announced that they were pivoting to a temporary online learning environment for this 2-week period at the beginning of the spring semester, we considered this a win. However, we, the SFSS, and a large segment of the undergraduate student population believe that SFU's decision to move back to in-person learning beginning January 24th rather, is too soon and almost a reckless and irresponsible decision to be making in the face of not even hitting the peak of the Omicron wave yet. Many of our members have contracted COVID over the last month and have described symptoms that are anything but mild, despite the messaging around COVID very much downplaying its severity. For these students, the decision to return to campus so soon feels a bit like a slap in the face, that the university won't be proactive in trying to prevent you from getting COVID. Essentially, students are on their own. The onus is once again on us.
We surveyed students and received 5,344 responses. Even within the first day or so, we received over 2,000 responses from students, which I think just shows how much students want to have input in the direction where they want to set themselves in an educational environment and in the ways that they want to learn. From the data, we identified 3 key areas of concern for students at SFU. One is safety, the second is wellness, and 3 is action. So in this question, did you feel unsafe attending in-person classes at any point during the fall 2021 and in regards to the semester? From the very beginning, students have expressed their concerns about the lack of effective measures being taken by the university and provincial government to protect their safety. During the in-person return to campus in September, some classes remained online, but the vast majority of classes back in person. More than 2/3 of students surveyed said that they felt uncomfortable or unsafe during in-person classes. So 61% responded yes to feeling unsafe in attendance last semester in fall 2021. 32% said they did not, and 7% it was not applicable. How do you feel about returning to fully in-person learning this spring semester? Our survey also establishes a clear majority of our membership who actually feel comfortable returning to campus, with 36% revealing various levels of comfortability with the return and 64% identified various levels of uncomfortability in the return. And I think that speaks to a lot in regards to students trying to find ways to protect themselves while being in in-person learning environments. Which learning format would you prefer to see being used at SFU for spring 2022? Almost 80% of students surveyed wanted some component of remote learning. 45% wanted full-on remote learning, whereas 28% wanted hybrid and 5% remote with an in-person exam. Looking at the data, this stresses the point that students for the university is to consider having some classes online and particularly large classes. The fact that only 20% of the students surveyed wanted in-person classes doesn't go to support the intent of the university to have full-on in-person classes. Would lecture recording make course content more accessible for spring 2022? And 94% of student responses said yes. 4% said no, and 2% said preferred not to answer. So I think that just goes to show in regards to accessible course practices, this is the way that students are leaning towards in regards to ensuring that, you know, in the return to campus, if they do become ill or if there are other extenuating circumstances, they still have access to accessible modes of learning. And I think that's something that has been brought up a lot in regards to, yes, recordings, but also forms of hybrid learning as well. So also in this survey, we got some feedback from students, and these are just a few of the many comments that we received. And these ones are in regards to safety and wellness. So safety, it was very anxiety provoking to go to school and be around large groups of people with little safety protocols besides wearing a mask. I'm also very scared to go back in person in the spring 2022 semester since the cases have risen. The other one is the main focus should be keeping students safe, therefore providing a safe online learning environment first and give support to students that will still want to come into class. So I think this says a lot in regards to students having to take on the individual responsibility of keeping themselves safe and the little protective measures that are in place in regards to in-person learning environments, as well as other spaces around campus. In regards to wellness, there was a lot of mental and emotional strain associated with in-person learning because I was afraid of contracting the virus and being sick and myself and taking it home to my elderly grandparents. Another respondent said, I prefer online because with COVID, my mental health around the fear is very real and very hard to manage, and I'm very scared of coming back to in classes. And mental health has been something that we have been discussing within the Student Society in ensuring that there are adequate services in place and trying to advocate for that. And I think, we take this in like very strong consideration, and we are, ensuring that the lack of stress put on students in regards to in-person learning should just be taken as serious as those who cannot return as well. So with the student survey calls for action, these outline some areas that we've identified from our student respondents. So the one is clear universal procedures and concession policies for all classes for students who are ill and in COVID-19 isolation. So that means, ensuring that students have access to either withdrawals from their courses, and ensuring that the university is supporting students if they do contract COVID, because what we have seen is that, the variant is anything but mild, and there are still long-term impacts that, you might not only just not be out of classes for a few weeks. So ensuring that there are measures put forward so that you can be in your learning environment in a good way. Remote or hybrid options to support students who are ill or isolating. So this was also brought up. Recorded lectures in every course made available online for students who must be absent due to illness or isolation. Technical support infrastructure to ensure faculty, staff, and students can use online learning tools proficiently and to assist with troubleshooting. And this was another area of concern that we have noted, just simply due to the fact that there was, in the fall semester, we took into consideration that there was a group of first years who were coming in to an in-person learning environment who did not have access to the technology grants or anything like that at the beginning of COVID. And also in the spring semester, when students were expecting to return to campus in person as well. These supports and needs are, a lot of first year students in our community still need a lot of these financial supports in order to properly participate in an online platform, whether that is like with a proper camera or a mic or anything like that. Another is easy access to PPE and health measures, which includes masks, hand sanitizer, and on-site testing. So this is another concern that was brought up. We have heard that in regards to proper protective measures, wearing proper masks, and has been recommended for the N95 and KN95. And that is seen, we should be noted that these are expensive, and we can't expect students to pay for a lot of these PPE, and the onus should be on the university in order for us to go back, that these measures should be put in place so that we have access to them. Regular opportunities for students to provide feedback. A lot of the decision making that has occurred has not really taken into account student voices and experience, as well as lived experience, that this has caused, so many things for a lot of people, as well as students, especially on the SFU campus community. And we need to ensure that we're consulting with students, especially folks who are more impacted by COVID, especially marginalized groups, BIPOC groups, disabled students at our school, and ensuring that we're taking care of them first for those who do not have access to either vaccines or ability to purchase proper protective masks or anything like that. So providing that consultative feedback.
As mentioned earlier, we released a public statement as a response to SFU and BC's government's response to COVID-19. In this letter, we released calls to action to SFU. So this included move classes and exams to be remote for the entire spring 2022 semester. And this decision is to be made well in advance of the January 4th, 2022 start date. Last minute changes done on a week by week or a month by month basis is not a sustainable learning and teaching environment. That January 4th was also the day where faculty and staff and SFSS staff were returning to work. However, January 20th was the first day of classes, but we did one earlier. Next is the public declaration of outbreaks and also contact tracing administered if positive cases arise. This includes the date, time of lecture, class, classroom number, professor, and class capacity. This was not formally used within the fall 2021 semester. Make rapid testing accessible to all symptomatic and especially asymptomatic students, faculty, and staff on all campuses in the upcoming semester and for the duration of the pandemic. Students should receive support when they test positive for COVID-19, including but not limited to managing COVID-19 symptoms, managing emotional issues related to isolation or quarantine, and the provision of alternative food service arrangement for those who live on campus. So I do start to think about students who do live on residence as well with these accommodations, and especially international students. Host a mass vaccination clinic or set up smaller vaccine venues on campus to promote vaccination or facilitate access to off-site vaccination services within the community. Ensuring that course syllabi are consistent throughout the semester and no last-minute changes will be made in regards to exams, coursework, or assignments. So for example, moving exams from in-person to online without adequate at least one calendar week notice, or ensuring significant and appropriate accommodations are made. So essentially, no last-minute changes, please. And ensure faculty who are vaccine hesitant to deliver courses remotely, even upon any possible return to majority in-person instruction, to ensure their safety and students' safety as well. And flexible learning accommodations for students in regards to exams, assignments, and courses for those who have COVID-19 anxiety, or who have family members affected by COVID-19. Moreover, we also want broader communication around academic concessions, easier access to deferrals, extensions, alternatives to the attendance requirements, and mandatory in-person participation. So for example, sometimes course syllabi do require in-person attendance, but sometimes if you do have COVID or contract COVID, that may not be possible for you to obviously attend in-person classes. So what accommodations would SFU faculty give for us as students? Moreover, accommodations for international students, so for example, remote learning, online submission of assignments instead of requiring paper copies for submission. And to ensure the continuation of the pass, credit, and no credit grading system for the duration of the pandemic that was initially implemented back in 2020. And a comprehensive communication plan should be in place about COVID-19 safety decisions tailored to SFU needs using actionable strategies. This plan should include any relevant guidelines on to what to do after returning from travel, as we are in a season where a lot of people travel to see family and loved ones, especially when we're returning from the holiday season.
So I'm going to outline some of the calls to action that were brought for the provincial government. And that is to make rapid testing accessible to all symptomatic and asymptomatic students, faculty, and staff on all campuses in the upcoming semester and for the duration of the pandemic. And this has been something that we have been advocating for since the very beginning, to ensure that we have this rapid testing on campus, just because it is inaccessible at the moment. Students have to travel very far and then come back to campus if they are on campus, or even just not having access to these in ways that make sense. Urge post-secondary institutions to make vaccines mandatory for all students, faculty, and staff on campus who are not medically exempt. Urge post-secondary institutions to shift on-campus learning and work to be remote for the spring 2022 semester, and create accessible financial opportunities, grants, and sources of funding for students being impacted by COVID who have had to take time off of work or school for illness. And we thought that this was really essential in regards to the precarious financial situation that COVID has put students into. A lot of folks are facing loss of jobs and sometimes not getting paid overtime, or also not being able to afford some things just due to COVID and the precarity of it, rising cases, and then also having to change in different situations like that. So.
And so the last thing we'll touch on before we reopen up for Q&A is the closure of the Student Union Building. So as we discussed before, our measures up until this point as it pertains to the Student Union Building included remaining open but at reduced capacity. This has worked really well during this interim period where we have been online for these 2 weeks. However, with a return to in-person classes on January 24th, acknowledging that there's going to be a huge influx and high traffic in and out of the Student Union Building, the SFSS executive made a recommendation to council, which our council approved, to close the Student Union Building. Now, I really want to emphasize that this decision was well thought out and was not easy to make. And actually, until a couple of days ago, it's something that the executive committee opposed making a recommendation on. But we, as I mentioned earlier, have been meeting daily for at least an hour a day, discussing our safety measures and ensuring that they are working effectively. And we had a lot of discussion around, what happens if there are COVID positive cases, which we know there are going to be, based on, what Bonnie Henry said herself, in that you should expect a third of your workforce to be out of commission at any given point, either because they are ill and at home sick or are at home sick with COVID-19. And so really, our philosophy here is not the philosophy of the Public Health Office, who frankly is treating COVID like it's an endemic already, even though we're very much still in the pandemic phase. We don't believe in the sentiment that, COVID is going to get you eventually. You kind of just got to get over it and get on with your life. We have a responsibility as an employer of a staff team of around 45 to 50 to protect their safety at any cost. And as an independent organization, we have the agency to decide what those safety measures look like. And those safety measures can look above and beyond what public health is advising. The decision made by the SFSS Council was not a light one. In fact, it was a 3.5-hour debate. Many amendments and questions and comments were made as it pertained to that motion. I think that's the longest debate I've ever witnessed on one single motion in my time with the Student Society. But at the end of the night, it was an overwhelming vote of 38-3. So 38 yes votes, 3 no votes. And I think it's important to mention too that our council are not, our council is very representative of the student body. Yes, we have the 7 executive officers who are voting members of council, but every other councillor represents a student group on campus. So for example, there's one councillor who represents political science. There's one councillor who represents physics. There's one councillor who represents history. So we're getting representation from all different corners of the campus, and 38 of those councillors saw the importance of closing the Student Union Building to prevent, in council's view, transmission in an environment that is very risky. And so the building will remain closed until February 18th. If the situation with COVID gets better before the 18th, we can look at opening earlier, depending on a number of factors. But right now, the opening date looks like it's going to be February 18th. But there is also the possibility of an extension of that. Hopefully that won't need to happen, but council will need to make that decision on its meeting on February 16th. And in the meantime, while the building is closed, all of our services will remain accessible remotely where possible. There will be some in-person services that will continue to be offered in person that are essential, such as many of our trauma-informed services and others of the like. I'll pass it to you, Matt.
Thank you, Gabe. Yeah, just to kind of touch on this topic as well, in order to properly introduce this, I'm going to be as concise as possible. The executive committee, we've made various decisions throughout the month of January and as well as over the holiday season. And I want to preface that these ongoing discussions and considerations have been made with the intention of community care, limiting exposure and transmission among membership, staff, and SFU community as a whole. And we have had to act urgently and know that we will be seeing ongoing changes, especially in these precarious situations. So one thing that I do want to make clear that, I have heard concern from students around closing the sub building. And, just to kind of elaborate on that is that, like Gabe was saying, we are an employer and we also have staff to consider. There have been numerous measures that we have taken into account. One, we have given the option for our staff to work remote. And also we have done the reduced capacity model and hybrid model for a few weeks. I do want to note that, some of this information, like some students do not know this, just on a daily basis. So in order to operate the sub building, we have a 6 staff minimum requirement. And what that means is we need 6 staff in the building for it to be open. In regards to what we have seen in rise in cases, and in the way that the student union building is laid out in relation to the return to campus, we cannot guarantee membership safety as well as our staff safety due to exposures and also transmission of the variant or COVID, even in a reduced capacity model. So what does that look like? Hopefully this never happens, but if let's say a building staff were to get COVID and then they were asymptomatic, or someone just had COVID and this situation could occur, or they were in contact with a membership who had COVID, this could lead to other staff, because we have a small staff force, just above 40 employees. It doesn't take much for a building staff to go into another area, and then also other staff may be exposed. And then as well as, if that were to happen, then we would have to close the building regardless if we could not meet this minimum requirement. And with the messaging that we have communicated with our staff, we cannot force them to come in to fill these positions because we have given the option to do remote work. So I didn't think, even for myself, to put staff in that situation where saying like, okay, well, if we keep this open, we're just going to wait and see. And if you don't get COVID, great. And if you do get COVID, well, then we'll figure it out. And I don't think that's a fair place to put anybody in. And so just kind of discussing that, regardless if we couldn't meet that requirement, we would have to close the sub building and there would be no notice. It would have to be until further notice, just due to because someone's sick with COVID, then we have to wait. And then other people are isolating, waiting for them to get sick and then recovering. And then even with that, we do not know the length of time it'll take our staff to recover. So we didn't feel as though it was a risk we were willing to take, and at who expense that is at, who expense it's at. And I don't think that's fair to put our staff in that position, especially when we don't know, if the reduced model will work at a full capacity model with the university. And those are just things that we have discussed, and we will keep monitoring the situation as exec and also reporting to council as well. But I also suggest students, if you do have questions, please reach out to your council rep, or also reach out to executive, because we are more than willing to have these conversations. Just because, you folks think that we're closing it just because to close it. There are reasons and there are things that are in place that we are trying to do in a good way to limit exposure and eliminate transmission and things like that on campus. So yeah, that's all that I have to say on that. Thank you.
Thank you. We will move on to question and answers. These questions come from SFSS membership who pre-submitted them, and we will go until 3:10 p.m. to answer. We do have an SFSS staff member who will be relaying these questions to us, so myself, Matt, and Gabe can respond accordingly until 3:10 p.m. and that will be the end of the conference and the live stream as well.
Okay, thank you, Jess. The first question in our Q&A is, why will the sub be closed off again when 97% of the SFU campus community is fully vaccinated? By closing the sub, it'll only force more students to congregate in the remaining spaces. This question will be directed at Matthew. Do you have a response to that?
Yes, so we've seen that was actually one of the oppositions like at the council meeting, and what we can do is only limit like the exposure where we see risk, especially within the student union building. And I'm sorry, Ella, are you able to type those in the chat as well, just to make sure that I hit all the points in there, please?
Yes.
Thank you. Okay, so even with, when we see like vaccination rates, this doesn't mean that we want to ensure that like even folks who are in our community who are still immunocompromised despite a vaccine or even being able to get a vaccine, especially folks who have been advocating, especially those with disabilities and even like immunocompromised staff, we want to ensure that we're doing the best that we can, especially with the variant, because we know that it is highly contagious. And then so also by closing the sub, it'll only force more students. Okay, so and that's another question that, like I said, was an opposition at our council meeting. And, all we can do is ensure that we are reducing capacity in the sub and ensuring that membership within the sub and also our staff, we're doing this in a safe way where we've taken measures based off of what we're given from PHO and also what we've seen on campus. I've gotten emails around like, okay, so you close the sub, so students will be going other places, and it's not expected that they're not reducing capacity in also like lecture halls and things like that. But I think it's just due to the safety concern that we're trying to mitigate that risk. So I hope that answers your question. If not, my email is also on the website, and I can send something else to you as well. So thank you.
Thank you so much, Matt. The next question is going to be directed at Gabe, and I have also placed it in the chat. It is, what is the definition of social distancing in a university that's letting 190 plus students sit close to each other in a 200 capacity room? How come I never received any notification on people getting COVID in my class, but I personally found many of them?
Yeah, thank you for the question. I'll take a stab at the first part of that question, and that's around physical distancing. This is a really good question because the guidance that's coming from public health is that physical distancing is actually not required in lecture halls. And the rationale behind that, and it's something I don't fully agree with, but I'm going to give you the rationale that the PHO has given, is that because lecture halls are what are considered organized gatherings, they are less risky settings and transmission is lower in these settings because you are sitting in one seat for an extended period of time. You're not mingling with a group of people. You're not kind of going back and forth. You're not front facing other people. And so in this way, they have deemed lecture halls safe, or as safe as you can get, really. And that's why physical distancing is not required in lecture halls. However, the same public health guidance also says that physical distancing is recommended in unorganized gatherings. So part of what is very perplexing is that social distancing is not recommended by public health in organized gatherings, but for unorganized gatherings, they are. So what's the definition of unorganized? Those are those are gatherings that are things like events. Those are gatherings like congregating in study spaces. Those are things like congregating in a dining hall or a cafeteria, which from our perspective as university students is essentially everywhere else on campus that's not a classroom. What's unfortunate is that the university seems to have no plans, and we've asked this countless times and advocated for it, is that there are no plans for the university to kind of move around furniture or put up messaging or really try and enforce any physical distancing when it comes to study spaces around campus or in dining halls or in cafeterias or places like Starbucks or food venues on campus, which is problematic because, students don't come to university just to go to class. They do a ton of other things while they're up here. And so it's not just about kind of protecting students in one type of environment. There are so many other factors and so many other environments that students are exposed to while they're on campus that puts people at risk. Now, I might actually tag Matt or Jess to take on the second part of the question, which is actually more related to like contact tracing. And Matt, maybe would you be interested in discussing that?
Yeah, so I remember there was a couple points where this was actually, I don't remember exactly. I think me and Gabe may have been in a meeting with someone from SFU admin, and we asked a question around like contact tracing and how come this isn't, and they're not required to do that, which is an issue in itself, just due to exposures and things like that in courses. So we don't really know, and we think that that is an issue because it's not required to do that within courses. And I think that's like a big component of what we are missing from a lot of data, especially now because we've only been back in person learning for one semester. And a lot of the data that has been received has been from K to 12, but has been used for also post-secondary. And I think there needs to be more data on that part. So I hope that answers your question.
Yes, it does. So that concludes the question and answer period for today.
Thank you everyone who joined in on the live stream, as well as in the Zoom room, who is our media. And I again want to say thank you for your patience as we were dealing with tech issues. All right, have a good day. And if you have any questions, please email us. Bye-bye now.